Hello, my name is Robin and this is Lucas. Today we're going to be talking to you about concussions. Did you know the annual prevalence of concussions is 1.6 to 3.8 million per 200 million athletes?
I didn't know that. So what is a concussion? What do we know about it?
A concussion is a type of traumatic brain injury that is caused by a force to the head, body, a fall, or any force that causes your brain to come in contact with your skull. Have you heard of the Concussion mechanism?
Yes, it is when there's damage to two sides of the brain, which occurs when the force of the initial impact between the skull and the brain causes the brain to move in the opposite direction and contact the opposite side of the skull.
Exactly. As an example, if you take a glass of ice and you shake it hard enough, the ice cube will hit both sides of the glass with one sharp movement of your hand.
So what are the signs and symptoms of a concussion?
Well, there are cognitive, physical, and emotional symptoms. This includes not being able to think clearly, trouble sleeping, nausea and vomiting, sensitivity to light and noise, as well as some balance issues, and becoming easily angered, upset, or sad.
When assessing a concussion, it should be conducted as soon as possible and in a quiet place. It will begin with an inspection of the athlete's general appearance and then move on to palpating the head, the neck, the facial bones, and then the C-spine.
Then we're going to perform a neurological assessment. This includes the pupillary reflexes and eye movement test. So you're going to cover their eye for about 30 seconds, remove your hand, and see how their pupil responds. Next, you're going to ask them to follow your finger as you move it across their field of view and see how they respond. Finally, we're going to do a test of the upper and lower extremity strength, coordination, and balance. This is the finger-to-nose test. Individuals with a concussion will do this test slower and more deliberate.
Once a concussion has been diagnosed, rest is the first step to allow the brain to recover. This includes limiting activities that require thinking and mental cognition.
As your symptoms improve, however, we can start adding more mental and physical activities. But be aware that if you add the symptoms too quickly and return to play too fast, then something called the second impact syndrome can occur. This is potentially fatal brain injury.
Okay, so before returning to sport, the athlete needs to follow 6 steps. The first step is no activity. The athlete must wait until there are no symptoms present before proceeding on to step 2. They also need to make sure that they avoid bright lights and they avoid loud environments. Step number 2, light aerobic exercise. These are activities like walking, swimming, or riding a stationary bike. Anything with a maximum intensity of less than 70% is allowed. No resistance training, and the duration and intensity of the exercises can change depending on how the athlete is feeling. Step number 3, sport-specific exercise. So an example of this would be skating drills in hockey. Anything that does not cause jarring or impacts to the head. Step number 4, non-contact training drills. So the athlete may progress to more complex training drills as long as they are non-contact. Examples of this are passing and shooting drills. Athletes must get medical clearance before moving on to step 5 because it is full contact practice. In this step, athletes are now allowed to participate in full contact drills and activities. And then lastly, we have step number 6, return to play. The athlete is now allowed to return to normal play as before.
So these steps do not correspond to days, and the amount of time you're in each step will vary depending on the severity of the concussion. If an athlete has symptoms in any one of these steps, they must return to the previous step for at least 24 hours. If symptoms do persist, they must not return to play. So there are a few ways to prevent concussions. This includes wearing protective equipment such as a helmet, ensuring that you are educating yourself on what a concussion is, exercising properly and regularly to ensure best strength and endurance, and ensuring you're using the proper hitting and tackling form.
In summary, multiple injuries to the same in the same period of time could lead to permanent brain damage and could even be fatal if left untreated.
So it's important to educate yourself and others on the symptoms of concussions and how to recognize them. If anyone has a suspected concussion, make sure you monitor them for 48 hours after injury.
Loss of consciousness doesn't necessarily dictate the severity of an injury. For more information, you should go to these links to find out more.
Thank you for listening.